are live. Where are we? 1, 2, 3, 4, 5. 5th of May 2019. I hope the 4th is still with you. If you're listening to the podcast and wondering what the hell's going on, then unfortunately Derek Griffin wasn't able to join us. I'm not quite sure. There seemed to be some technical problem in joining us. So we've done a little bit of a question and answer. If you like the podcast and you want to actually converse live as we're talking, then obviously come along to www.facebook.com/RunChatLive, and that's where the podcasts are recorded. And yeah, you get a chance. You can ask questions in the comments. Normally, there's not just my ugly face, but another guest on the screen as well. So it becomes kind of a three-way thing. And in the future, I'd like to do a four-way thing. I'd like to have two guests on at the same time, just something I want to entertain. I have got some exciting news coming up as well now, but on this damp now, I'm just feeling a bit. I had a fantastic run this morning. I always have a great run on a Sunday morning because I'm just thinking of the guest that's coming up, and as I get the joy of doing podcasts, as I get to choose the guests I talk to for free. I'm talking to great minds that I can select and I want to converse with. So my run in the morning sometimes is with my 2-year-old, sometimes by myself. It's just exceptional. A long Lancing promenade. I'm so focused on what's going to happen in about 3 hours, and sadly it's not coming to fruit. Okay, so this is cool. Live today, my guest is Matt Phillips, podcast host of RunChatLive, and he'll be answering questions. So what we got? Kristian Weaver. Is strengthening the glute med to prevent adduction at the knee still worth doing? Hey, you know what? This question and answer could be really cool. I've prepared nothing. So let's see. Okay, so let's just put this question up so everyone can see it. Here's a question from Kristian here. Okay, so strengthening of the glute med to prevent adduction. So yeah, there is of the literature and studies we have got on changing biomechanics to potentially reduce pain. The glute med strengthening is a fairly strong one, but there is contradicting studies as always. This is the problem, and this is why a reoccurring theme in working with runners is always work with the runner in front of you. Okay, because it's always worth trying these things, but if it doesn't work, then you just have to move on. And also, because the thing is, there is studies which show that strengthening the glute med, I can't think of them offhand, Derek would straight away, but there are studies which show, decent studies, which show that strengthening the glute med to prevent adduction can reduce ITB syndrome, tibial stress, and they're successful. But the trouble is there's other studies which are just as good, show runners who maybe have got iliotibial band syndrome or tibial stress syndrome, and they're not adducting, or they've got perfectly strong glute meds. So whilst that happens, it makes it a very grey area. It is, my advice is, Kristian, if you've got a runner who, and presumably you're asking this question because they are suffering from something, they're in pain, then if you're trying to find that piece, that jigsaw, put it together to help them, then yeah, strengthening of the glute med is still something. If I find they're weak and they're in pain, then yes, I will, in combination with other things, I will get them to strengthen that glute med. What we do know also, which is interesting, is just because you strengthen the glute med, let's imagine you give them exercises like band walks and clams, or all these other exercises, lying abduction, leg raises. Studies also show that just because you give them a stronger glute med to do that exercise, the actual way they run doesn't necessarily change. And that kind of makes sense because the brain is very much context driven, and it uses muscles in the context. You lying down and getting stronger at raising your leg in the air won't necessarily have a knock-on effect to you needing to keep the pelvis maybe slightly from dropping by using the contralateral glute med. So one thing I do recommend is if you are doing strengthening of some particular muscle group, because you're following the research, which is cool, then also you need to check whether there's some gait retraining as well. The glute med often goes hand in hand with pelvic drop on the contralateral side. So when we do have runners suffering from ITB or tibial stress, then yeah, we'll use that combination of glute med strengthening, tangible, so you can see them actually getting stronger, but also checking whether they need to be doing some kind of running gait retraining, such as getting to do wide drills, running slightly wide across a line. That's been shown as well to help alleviate symptoms. So yeah, still worth doing, but it's not going to be the be all and end all. And as always, my answer to all of these questions of is it worth doing is you have to look at the pyramid of evidence. Okay, whenever you're treating any runner, and at the bottom, on its kind of 80% of running related injury, the key factor is inappropriate loading. So before you get into the, is their glute med weak, or are they running too narrow, or are they wearing the wrong shoes, or do they need to do more stretching or whatever, you need to make sure, is it something far more integral and basic, as in, have they done something too much, too soon, too quickly? Look at their training. That's where a lot of it is going to make a difference. So hopefully, Kristian, come back if you want with another comment, and we can keep that conversation going. Yeah, hopefully that helps. Okay, what else we got? Let's have a read through here. Let's just get rid of Maria from support, because that's just not helping me. Right, follow up. Our clams, let's hide current comment. Kristian is still got the floor. Kristian has the shell. And Kristian is saying, follow up, are clams enough to elicit changes in strength? There are some interesting studies on the effectiveness of different exercises. You can Google them and find them. There's kind of a nice little kind of chart of which exercises show strengthening. I don't think, in terms of when they do the EMGs to see the stimulation of muscle fibers and therefore use that as a measure of how much the muscle is actually being affected, I don't think clams come up that high, which is why obviously some people say, I'll never do a clam again. I think the choice of exercise, though, an important factor is where that particular runner or patient is in terms of ability to do the exercise. How, sometimes you need to take it down to the ground, you need to take out other factors, whether it's just to relax the client, whether it's so they can really focus on performing it a certain way. Normally, in terms of exercise choice, I use the continuum where you want to move from the floor to the way that particular muscle group is going to be used in the desired activity, which in our case is running. So it kind of makes sense not just to stop at the floor. You need to take them to a single leg exercise, whether that be hip drop, or hip raises, or whether it be sided adduction, crab walks or something. You need to get them standing up. And then a running drill, like I say, to actually use that strength that they've gained in context. So the clam has a place, but again, you've got to think of context and doing something as closely related to running as possible, which obviously lying on the floor isn't. I hope that answers the question. What do we got? Let's have a little look down. Matt Hart, right, Matt, thanks for joining us. What do we got? Are we not just improving low capacity rather than preventing adduction? Interesting question. You know what? Maybe that's, is that a bad thing? This is always the question. We know that the kinematics and the kinetics are both involved in pain. Sometimes it's not a case of trying to get them to move differently. It's just increasing load tolerance. It's probably a mixture of the two a lot of the time. The interesting thing is also that with gait retraining, sometimes the runner, along with the strength exercise and the gait retraining, they'll see symptoms decrease and disappear, which is great. And then they'll gradually just drift back into their normal way of running. Let's imagine they started with a crossover. They did some gait retraining to reduce that crossover. And then the pain goes, which is fantastic. Happy days. And then you do a follow-up gait analysis and they're crossing over again, but they're not in pain anymore. So this again, creates an interesting discussion of, was it actually the crossover gait that was causing the problem in the first place? Because if now they've got over that pain and they've reverted back to a crossover gait, you can't say crossover gait, caused that problem. I tend to see in a lot of cases, when it comes to the biomechanics, looking how someone moves, it's all about reducing the load to tissues that have been sensitized, or the system's been sensitized when that tissue gets used. So if you can keep someone running and keep therefore kind of the nervous system happy to do that activity without feeling threatened, then fine. However you manage to do that is great. But once the system has become desensitized and it's happy to run again and use those tissues, whether it's through load capacity or changing the kinematics, then that's kind of job done. And a lot of times I think that's a healthy way to look at it. And that helps put all the biopsychosocial together, I think, having that framework. So yeah, I hope that kind of creates yeah, give me a follow-up, Matt, if that kind of helps or doesn't help. Or let's do that. Oh, I like this. I wonder if there's anyone else. I might actually make a whole podcast out of this and just do once every couple of months questions with Matt. This is going to backfire me, isn't it? No, it can't do, because I'm not scared to say I don't know, which makes me such an incredible therapist. Let's have a look. Kristian is back in the house. Kristian, do you use orthotics with patients? If so, where is the current evidence? Brilliant. This is great. I love this. If you haven't seen it already, then check out our episode with Sports Pod Ian Griffiths. Ian is my go-to guy for orthotics. I used to have, I still have it. No, I haven't got it anymore. I used to have quite a lot of kind of podiatrist envy because if there was a gap in my studies, then it definitely was kind of the foot down. I saw the foot as always a little bit threatening. Not knowing when it is actually the kinematics of the foot that's making a difference. So it was with much open arms when I started seeing Ian Griffiths talking a lot about how, again, it's not the kinematics, the biomechanics of the foot. It's a very grey area again. Obviously, there may be some kinematic issues going on, but a lot of the time, again, it's the kinetics. It's the actual way that tissues are having to handle force. And we've seen that when you put an orthotic device into a shoe, you're always going to change the way that that foot has to deal with the forces. It will be redirected. Even if you put like an odor eater in, there will be a redistribution of forces. So in a lot of cases, and the podiatrists who I tend to kind of work with and refer to, and this is why Ian is my go-to guy, Sports Pod, because yeah, the modern version of orthotics is seeing them as a way of redistributing forces and offloading tissue. Craig Payne, who is the kind of co-host of RunChatLive, which is an amazing podcast you should all be listening to as well as mine. Yeah, they're very much into that. Okay, it's not just about kinematics, and the literature and the studies, they show that the old idea, because what do you base kinematics on? Are you trying to make everything symmetrical? Tricky, because the literature doesn't support the idea that we need symmetry in the foot to alleviate or avoid pain. Are you trying to reach a series of norms? Have you made, following these values which everybody should be adhering to? Again, tricky, because we know that not everybody has the same norms. There's a lot of anatomical variance within the structure of the foot and the way the bones sit together and the way the bones move. Ian will go into I have to have him back, actually. I'll have a chat with Ian. Ian talks a lot about how it's more about the timing of the movement, the moments, as opposed to how far, let's imagine the subtalar joint or the medial arch dips or doesn't dip. It's not about the quantity of movement. It's often about whether the quality suits the person who is dealing with those forces. So do I use orthotics with patients? Asked Kristian. I will use off the shelves if I feel, for example, that they may well offload I don't know, the tibialis posterior or something. If I feel they've got some issue going on there, and then I can offload the tissue by having them use one of the off-shelf orthotic devices, then I'll try it. I will give the runner a go to run in it. If the pain is reduced and it means they can keep on running, as well as doing any other particular part of the recovery process that I think will help, then that's a good thing. How it's helping may not be so important. And sometimes I'll experiment with different off-the-shelf orthotics, even if what's on the packet doesn't adhere to what, in theory, it should be doing. Because most orthotic devices off the shelf are kind of, you've got your red, yellow, and green, like high arches, low arches, and neutral. And it's the same problem as the shoe. You can't categorize runners into 3 different categories. and it's pointless because, again, you're trying to make people fit into this norm, this neutral, where everybody will be happy. It's just not the case. There's plenty of people who adhering to your norms and your happy place, and they're in pain. So yes, I do use them, but for all the different reasons then probably traditionally they are prescribed for. But like I say, yeah, check out Ian Griffiths if you haven't already. What we got? Matt Hart came back. The issues around foot orthosis is dose prescription. Research does not provide this, and there is the issue. Yeah, this is the problem as well. Let me bring that comment up with regards to the use of orthotic devices. Again, if there's runners listening to this, which hopefully there will be a lot, particularly on the podcast, obviously you can't see the questions that I'm putting on the screen, but Matt Hart has said the issues around foot orthosis is dose prescription. And dose prescription is a really important thing. A lot of the time, runners who go to see podiatrists are under the impression that the way the podiatrist is going to help them is they're going to correct some biomechanical flaw, and they're going to give them something that should be there for the rest of their lives, whether it's a suspected or a leg length discrepancy or flat feet, all these other kind of ideas, which again the literature doesn't support. If a podiatrist does prescribe you some form of orthotic device, some insert into the shoe, then it should be a clear, the same as with exercise, there should be a clear timeline of how long I want you to use this for, whether we're going to start using it less and less, whether you're going to have a different type. There should be this timeline going on, ending in most cases, not always, but ending in eventually you won't be using them anymore. Okay, they are almost, I compare them sometimes to a crutch. Okay, you are going to use them for a while, but you're not going to use it for the rest of your life, because last year you did a very successful 2.5 hour marathon and your feet haven't changed. You still had the same length legs. Okay, something else has happened along the line, but you were born this way. That's that's the thing which we have to remind a lot of patients who feel that, oh yeah, but I think it's because my hips are unaligned. And no, if you were born that way, if it's a structural issue, then we can't really blame that for the pain. It's more likely to be you're overloading tissues, you're doing too much too soon. We can offload tissues by changing things, playing around with strengthening and stretching and stuff. But the idea that this particular orthotic device is going to put you back into shape and realign you, as soon as you hear the word realign, then alarm bells should go off. Okay, because realigning, a bit like overpronation, is a word that brings connotations and that just aren't going to be very evidence-based. So yeah, dose prescription. It's a very good word that should appear all the time when you and if you go and see a podiatrist with the idea of getting inserts. So let's get rid of that. Thank you, Matt, for your contributions. Mike James, bummer, gutted there's problems. Always thought Matt smashing it. As always, Matt smashing it solo. Thanks, Mike. Yeah, yeah. Matt, those of you, again, if you listen to the podcast, I have to keep remembering that not everyone's watching this live. So Mike James is another guest who we had on the show. Fantastic, the endurance physio. Not to be confused with endurance physio, who's also getting bigger on Instagram. Remember, Mike is the endurance physio. The is very important. I think Adam Meekins had this as well in his early career, where there was the sports physio and just sports physio. People were getting a bit confused. But yeah, just remember, Mike James is the endurance physio, because yeah, Mike's putting out some fantastic. Mike, I can speak to you personally. You're putting out some fantastic information lately. It's great. All around the London Marathon, there was a lead up, there was during, there's now follow-ups. So whether you're on Instagram or Facebook, then make sure you're following the endurance physio and Mike. So yeah, thanks, Mike. I'm sorry that Derek's not here, because Derek is great as well. But hey, hopefully we'll get him back soon. He's going to try the iPad. He may well appear soon. But Mike, yeah, feel free to add some comments and join in if there's anything that comes on the screen which you feel you could lend your huge experience to. Right, what we got going on? Where are we? 2:04. We've got another 26 minutes. Andrea Colombi. Rather than using orthosis, can short-term changes in running form from midfoot to heel striking and vice versa? Oh, let me just put this up on the screen so you guys can see it. There we go. People watching the video now will be able to see the comment. So Andrea Colombi, rather than using orthosis, can short-term changes in running form from midfoot to heel striking and vice versa be a way to keep training without irritating issues more? Yeah, for sure, without a doubt. And I love that you've used the example of, God forbid, changing from a midfoot to a heel strike. For a few therapists and running coaches and runners already, that very idea is just like unspeakable. It's like, saying Candyman 3 times in the mirror. But it's a good example where we know there's no one optimum way of running. It's all about what your tissues can handle. Some people are born with different thresholds for tissues. You may well be able to change it through strengthening. It may not be necessary. You might find that it's more of a natural way for you to land with a heel strike because your tissues support that. Or it might be normally a midfoot or definitely a forefoot demands more tissue tolerance on the Achilles and the calf complex. But if you're born that way and you're better off using those tissues rather than putting load on the knee, then that's the way you're designed to run. But yeah, it's interesting because if we do see pain, for example, in the Achilles or the calf complex, again, putting someone back, like you said, Andrea, I've got to be careful here. I don't know if Andrea is male or female, or whether I don't know. Andrea, let us know. It sounds like, I don't know, let us know. But Andrea, yeah, definitely. The important thing often is letting someone continue running. We know that if you take someone out of running, then that's just to a certain extent reinforcing the body's threat of running. Full recovery comes when the body will accept running, will accept that sensory feedback that I'm upright, I'm bobbing up and down, my arms are contralaterally moving with my legs. That's when the brain will kind of think, the nervous system will know that this is what it perceived as dangerous before. So if you can get somebody during the recovery stage to run with a midfoot to a heel strike, or change them from a heel strike to a bit of midfoot, then yeah, that's a great way. Yeah, definitely. So that's a very good comment, Andrea, who's male. Sorry, Andrea. So it's Andrea. Where are you from, Andrea? Do I sense a little bit of Spanish or Italian? Or yeah, so Andrea's very male. I just can't even tell from your profile photo anyway. So I hope that answers you. There we go. Yeah, changing someone's running form. It's a good question, and it shows you on the right page. Matt, same with running footwear. We can use different shoes with varying geometries, cushioning properties to influence loading. Yeah, great comment. Again, I mean, I'm biased. Everyone's biased. But I think it's a really useful page to be on. If you look at interventions like orthotics and footwear, tweaks to running form, if you see them as ways of just varying geometries, like Matt has said, of changing the tissues you're loading and how much you're loading different tissues and loading the system, because ultimately it's a very fine line, or it's not even really a line between your nervous system and which tissues you're loading. It's all really the same thing. But yeah, that's a much healthier page to be on, I think, as definitely as a healthcare professional in the clinical perspective, rather than thinking I'm using this intervention to make you into that shape, or to run this way or that way. So yeah, definitely, Matt. Yeah, varying geometries. I like that. Exactly how we should be using shoes, which is interesting because certain shoes will, in theory, suit us more if we are suffering from a certain symptom. I've got so many shoes in my wardrobe, depending obviously on the distance I'm running, what I'm running on, but also whether I'm feeling like the calves are a little bit overloaded, if I'm feeling something in my hips or in my knees, then although it's anecdotal, I've got my go-to shoes if I'm feeling a little bit of knee pain. How much of that? Well, the important thing for me is how do I measure it, whether it helps? It does help. It feels like it's helping. But I think there's more evidence there thinking that, well, if wearing these shoes I feel less pain on my knee, then obviously they're doing something which is working. But then the following week or something, if my knee's feeling better again, I'll go back to my go-to shoes or something. So yeah, it's a nice excuse for men to have loads of shoes in their wardrobes as well, which is always good. Right, thanks, Matt. Another great comment. There's some exciting news in the pipeline. It's a bit premature now, but yeah, I may as well kind of talk about it briefly until another question comes along. But I'm in the process of organizing as large as possible running conference down here where I am in the south of England on the south coast, designed to give something to definitely therapists who work with runners and coaches and personal trainers, but also for runners as well. I think you gain more from having runners in the same room as the therapist, because there shouldn't be any secrets really. It might be a different level of understanding, but I want to try and make a conference which is appealing to runners as well. And yeah, I'm hoping to get some international speakers and national speakers along. We'll make it a great 2 days, and also we'll do ideally, I'd like to do a couple of live podcast debates as well, where we'll have a panel, we'll record it all, stream it out, and get some people talking. Maybe, I mean, it's tricky because I tend to surround myself on the podcast. I definitely invite people who I know I'm on the same kind of page as. There's often that desire to get someone who is not on the same page as you, just to create some interesting debate. But the trouble is, if someone's not on the same page at all, then the debate is kind of tricky. It's like putting Richard Dawkins in a room with someone from the clergy. As soon as they say, well, on the 5th day, God did this, I remember seeing Richard Dawkins, I've seen him a few times. And it's like, whoa, stop there. The world wasn't created in 7 days. Well, I know that, but Richard Dawkins is like, well, no, we can't talk about anything now. I can't be having a debate with you if you're going to make that suggestion, because it wasn't. So it's a bit like that. I love the idea of getting somebody who is heavily into something that I don't agree with, but I don't think it'd be a very entertaining conversation. But that said, if I do a conference and invite people along to sit on the panel and sit in the audience, a bit like a question time, but when question time used to be good and not just a kind of the government influencing the BBC to say what needs to be said. But yeah, if we manage to do a nice question time, I think it'd be great anyway. But that's something which I'm putting together. A timeline, I'm not sure yet, but I think it would be really, really, really quite cool. And it might turn into a yearly thing. So that's exciting. So what I'll do is I will round things off. Thank you to the people who joined us today. I'm sorry I let you down. Well, yeah, I'll take it on my shoulders. I'm the host. I'm sorry that Derek wasn't able to join us. Obviously, I will try and reschedule that for as soon as possible and work out what went wrong, and yeah, make sure it doesn't happen again. What do we got coming up? Well, apart from Derek being, I just got the message from Derek, not having any luck. Oh, bless him, what a lovely bloke. Well, definitely from having Derek coming up in the as near future as possible. I can also confirm that on May the 19th, we got JF Esculia, who's going to be here. I'm going to make sure I meet up with these people an hour before to get it all sorted. So JF Esculia is going to be with me in the studio, well, online anyway, who I'm very much looking to talk to. I don't want to preempt it, but I mean, JF Esculia I've followed for a long time as well. In the past, him and Blaise Dubois, I've often kind of watched them almost as the nemesis to particularly Craig Payne and the kind of like podiatry arena. There's been some very fierce debates, especially with the era of Born to Run and certain claims of barefoot and not barefoot. Everybody's kind of progressed since then. I think it's a much more kind of we're on the same page playing field. But yeah, I'm looking forward to talking to JF an awful lot. And I know JF has done work with Greg Lehman as well in the past. I should really try and get Greg on the show, but he's busy swearing with Adam Meekins, I think. But yeah, it'd be great to get Greg on the show. Maybe Adam Meekins, although if you follow Adam Meekins' timeline, I'm not sure whether he's going to be banned from Facebook and Twitter and Instagram soon. He's going through some hassles. I'm sorry to hear that, Adam. It's a ridiculous world we live in. But I hope that sorts itself out for you soon. June the 16th, Christopher Johnson, fantastic person who I'd love to get over to England. It's definitely well overdue. the running zone. I mean, Christopher has got so much information. He does some fantastic courses. Yeah, so a couple of names there for you to put in your diary. If you want to know a full list of who's coming up, then make sure you go to www.runchatlive.com, my website. And if you subscribe to that, then I keep you up to date with newsletters, just to let you know what guests are coming on. It's free. It's just a way of communicating with people and giving that extra bit of information and heads up. So yeah, runchatlive.com, subscribe. I've been playing around the website. I think I've finalized it now. I like the design it's got. So I'm uploading a lot of the stuff which came from sportinjurymat.co.uk. Slowly but surely. There's an awful lot of information I've got to put on there, but I'm just putting it into the new format, updating a few articles here and then. So head over there. It's always nice to see people subscribing. I don't spam you. I just give you once or twice, or once a month, or once every 2 months, a little letter just saying what's going on at our end. That's it. As always, if you enjoy the podcast, I know today probably hasn't been the best one ever. I'm gonna have to edit it and have a good listen to whether I actually put this out. But if you do enjoy the podcast, then what is important for us is to like us, particularly on iTunes. But anywhere you choose to watch this, just click that like button, leave a review, subscribe if you can. Nothing happens if you subscribe. You don't get charged. I know it's a horrible word. It just means that we appear higher up in the lists and we get exposed to more people. We're not making money out of this. It's just a case of delivering the information to people, so that the more of you who actually click on that like and subscribe button, particularly in iTunes and Apple, then the more we feature in lists and higher up in charts, and the more the information gets out there. So if you like what the guests have to say, or what I have to say, and you want to pay us back in kind, then great, do that. Just go to your Stitcher or iTunes or Pocket Casts, or even Spotify. I think it's a great place to listen to podcasts as well, and just subscribe or like us on that. Yeah, that's it. Right. Well, I will draw this to a close. My apologies to Derek if you're out there or somehow listening, or if you listen to the recording of this. Sorry about that, mate. Giving up your morning. I feel like screaming at someone from Belive TV. I don't know what happened, but hopefully we'll get together and sort it out another time. Right, so thanks for joining me. I'm going to try and put Derek in another date. Keep an eye on Facebook. Keep an eye on my website as well. And I'll let you know when Derek reappears, and of guests that we've got coming up. Until then, take care. Thanks for joining us. And hopefully I will see you on the other side of this camera very soon. Thanks very much. You're listening to Run Chat Live podcast, putting the evidence back into running injury and performance.